Hello, in this video I'm going to discuss the Caroto-Cavernous Fistula. Before going to Caroto-Cavernous Fistula, I would rather like to revise the anatomy of the cavernous sinus. One must understand the anatomy of the cavernous sinus. So here you can see the left cavernous sinus which is shown, but on the right side cavernous sinus has been removed just to show you the structures which are passing through the lateral walls and within the cavernous sinus. This is the superior ophthalmic vein, which is draining posteriorly draining the orbit posteriorly into the apex of the cavernous sinus. So this is the intercavernous sinus, communication between left and right cavernous sinuses, and this is superior petrosal, inferior petrosal, then the basilar venous plexus. So in our next diagram, we will be look at this thing. Here the internal carotid artery in red, and it is surrounded by the cavernous sinus, all cavernous sinus in blue. This cavernous sinus, it contains the venous blood, whereas this red structure, which is internal carotid artery, contains the arterial blood. Arterial blood is warm and venous blood is cold. So actually the purpose of passage of this internal carotid artery from the cavernous sinus, according to some researchers or scientists or anatomists, is that actually heat exchange between the warm arterial blood and cold venous blood, it actually takes place. And beside that, these are the structure which passes through the lateral wall of the cavernous sinus, which are oculomotor, trochlear, first two branches, which are ophthalmic and maxillary division of the trigeminal nerve, then abducens nerve, which passes inferior to the cavernous sinus. So this actually diagram you're looking at, it is actually the coronal section of the cavernous sinus. So uh, what is fistula? Fistula is actually a abnormal communication between the two epithelial surface. As we already know that cavernous, internal carotid artery shown in light pink, it actually passes through the substance or within the cavernous sinus, which is here you can see it is surrounded by the cavernous sinus, which is shown in the red. While it is shown, why it is shown in the red, I will be discussing in a while. You just look at this two small arrows, which are denoting that actually the abnormal communication has been developed between the epithelial surface of the internal carotid artery and cavernous sinus. It could be post-traumatic or due to any rupture of the aneurysm, which most likely the Berry aneurysm. So abnormal communication has been developed. The pressure within the internal carotid artery was greater as compared to the cavernous sinus, as it is the venous blood. So with each pulsation, each contraction of the heart, the blood is being poured into the cavernous sinus. So the pressure within the cavernous sinus is being raised, blood pressure. So you look at the superior ophthalmic vein shown above in the orbit, and this is inferior ophthalmic vein. They both drain posteriorly into the cavernous sinus, so that the pressure which was developed within the cavernous sinus due to pouring of the blood from internal carotid artery into the cavernous sinus is being transmitted to the superior and inferior ophthalmic veins. Look at superior and inferior ophthalmic vein, they actually become dilated. So as a result, they push the eyeball forward. So eyeball would be pushed forward, or you can say the proptosis on the affected side. What is proptosis? Proptosis is protrusion of the eyeball on the affected side. So beside that protrusion, there would be pulsation of the eyeball with each contraction, because as a result of contraction, blood being poured into the cavernous sinus, and that cavernous sinus is transmitting its pressure in the form of pulsation into the superior and inferior ophthalmic vein. And this is pterygoid venous plexus. This is facial vein. Pterygoid venous plexus and facial vein, they are connected by means of a deep facial vein. So pterygoid venous plexus finally drains into the inferior ophthalmic vein, which drains into the posteriorly into the cavernous sinus. So all these structures will be dilated and engorged with the blood, and as a result eyeball would be proptosed, and plus eyeball would be pulsate with every arterial pulsation. Thank you very much.